Mental health services for adolescents should always be top priority. Desert Wind Hospital, the sponsors of this segment, ensure that here in Southern Nevada and also nationwide.
Hi, my name is Adina Archibald-Boujet. I'm the Director of Clinical Services here at Desert Winds Hospital. Desert Winds is a freestanding psychiatric facility that caters to adolescents ages 12 to 17. So post-COVID, what we've seen is a significant increase in depression amongst adolescents, having difficulty returning to a regular school setting, having been home for such a long period of time with the stressors of potentially their family having lost their jobs and maybe not being able to provide them the same level of care that they were having before. When you arrive at Desert Winds, whether it be from another facility or as a walk-in patient who is in crisis, you will be met with an admissions counselor who will provide you with an assessment to determine what's the best level of care. If it is that you're in crisis severe enough to require inpatient hospitalization, they will walk you through the steps of getting admitted into the hospital. Here at Desert Winds, we take an integrated approach to care. We include the families as well as the psychiatrists, the doctors, teachers, therapists, to ensure that we're providing the optimal care for their child. Quite frequently, families are concerned with payment options and how to get access to their services for their child. We do accept several different insurance coverages, such as Nevada Medicaid, TRICARE, as well as commercial insurances. We also use care credit as a payment option for the families if they need it. Accessing residential treatment is quite difficult for adolescents, so we want to ensure that we also offer this to out-of-state patients. So to accommodate that, we offer things such as modified timing for phone calls when they live on the East Coast per se, or airport pickup and specialized therapeutic passes for the families when they come to visit. We can accommodate patients out of state on our acute level of care as well as our PRTF. Our PRTF is a little bit different in that it is a longer term stay. Our average length of stay in acute is 5 to 7 days, while on PRTF it's approximately 90 based on the patient's needs. On our PRTF, we do provide recreational therapy, process groups, psychoeducation groups, 24-hour nursing care, as well as 24-hour observations by mental health techs. We do have a fully licensed school, so the patients can receive credits while they are here, so they are not pushed behind in their academic journey when they return home. And if you are part of our acute care, much like PRTF, you will receive an evaluation from a psychiatrist and will be provided oversight by the psychiatrist daily. You will receive a therapist, process groups, psychoeducation groups, a smaller version of educational materials so that you can stay current in your education. And you will also receive 24-hour nursing care as well as 24-hour observation. PRTF candidates would be candidates who are no longer in crisis and need longer-term care so that they can reintegrate slowly into the community. Acute care is crisis-driven in that they are currently a danger to themselves or others, or demonstrate an inability to care for themselves. Here at Desert Winds, our goal is to provide the best care possible to youngsters who are struggling. I myself have been a social worker for over 20 years, and I am proud of the program that we built here. Our goal is to make sure that the patients can go back safely to their homes, go back to school and be safe and be able to cope in this world, because things are pretty difficult now.
Thank you to Desert Winds Hospital for sponsoring that segment. For more, call 702-202-2711 or visit desertwindshospital.com. We'll be right back.